Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I wanted to show off this case because sometimes really subtle changes make a big difference. So this is Caitlin, and Caitlin came to us looking to close some small spaces between her upper front teeth. You can see maybe that there's a small space between the upper two front teeth, and to resolve some crowded lower front teeth. And I'm not going to focus on the crowded lower front teeth. I could show you a million cases where we've resolved crowding of the lower front teeth. But as we talked about our treatment plan for creating Caitlin's ideal smile, there were a few other things that we talked about trying to improve. One of them was that I felt like when she started, her upper canine teeth were very prominent. They really draw the attention of the eye because they hang down further than the incisors, and they're also prominent because they stick out just a little bit. And between sticking out and maybe a little bit of a narrow smile, it kind of seems like her teeth, as you go from the front to the back, they just start to like disappear in the darkness back here. And this area between the teeth and the corner of the lip is called the buccal corridor. And we like to fill those buccal corridors. We want to see teeth back there so that you have this big wide smile and you're showing off teeth all the way from molars over to molars. We also talked about how not the front two teeth, but the next two teeth were a little bit asymmetric. So the one on the left side here is a little up higher than the one on the right side. And we talked about how the gum tissue on the left and on the right is a little bit different. So just a close-up of where Caitlin started, you can really see the difference between those lateral incisors, the second teeth, being at different heights, and the gum tissue being at different levels there as well. This is where we finished, and really the main thing to note here is if you look at the lateral incisors, they're now at the same level, and the gum tissue really doesn't look a whole lot different. That's not something that we can address in orthodontics. It's something that we could send Caitlin to a periodontist, and they could probably remove a little bit of gum tissue on the upper right one and make it look like the one on the upper left. And so that is something that she could go and pursue if she was interested in doing that. So here's our final, and I want to bring up them side by side. And so some really subtle changes here. If you notice, first of all, when we talk about those buccal corridors, we've really widened the smile a little bit. We can see a whole nother tooth on each side. And this may be a slightly bigger smile, so there might be some things about the way that she's smiling, but no doubt that we have a bigger and wider smile, and you can really appreciate that from the side-by-side pictures. The second thing we really focused on was bringing the upper four front teeth, the upper incisors, down a little bit more. And so you can see just a little bit more gum tissue above those upper incisors, which indicates that we brought them down a little bit. And what that does is it makes the canine teeth less prominent. Now your eyes are not drawn to those canine teeth. And even though they still hang down just a little bit longer than the incisors, they should do that because that's how the bite is going to function well off of them. But your eye's no longer drawn to them. And so changing the position of those canine teeth by pushing them in just a little bit and widening the teeth in the back made the smile look wider. Bringing the upper incisors down a little bit makes the transition from the incisors to the canine a little smoother, and so that your eye is not drawn to the canines. And so I really love these changes, and these are really, really subtle changes that a lot of people don't think about. People don't think about what goes into creating a nice smile, but I obsess over these things, and I obsess over the width of the smile. I obsess over this idea that we call smile arc, which is kind of the transition of the incisors to the canines and making sure that it follows the curvature of the lower lip. So these are all the things that I think about. And, as I mentioned earlier, if I was being critical of our final result, I'd say that I still would like to see the gum tissue of the lateral incisors be even. And that's something that, again, a periodontist, a gum specialist could take care of and make those nice and even. So if Caitlin ever decided that she wanted to do that, she certainly could. But I love these, this maybe not, she didn't start with teeth in crazy places, or we didn't extract any teeth. This was not a really extravagant treatment plan, but I think it makes a huge difference in the quality of her smile and in how she feels about her smile. And so we love celebrating our patients like this. We love celebrating our kids. We love celebrating our adults. We love celebrating some of our seniors that go through treatment. And I really love celebrating each and every patient. Caitlin was a great and fantastic patient, and she got a great result. And we're just both so happy for her. So thanks so much for being awesome, Caitlin. Hope you enjoy your new smile.